Medical things they don't tell you: tomatoes, watermelons, fruits and vegetables that are red in color usually have a nutrient called lycopene, which can help prevent prostate cancer. A comment like this is interesting because I actually hear this often, that people who are living outside of the United States who are eating organic whole foods tend to have a good enough quality of life. We used to think that unless you're in a modernized nation with certain access to medications, you would be the one that would survive the longest. But it's interesting to note that maybe the food that we have in the United States is actually leveling the playing field in a bad way. And sure, you can make the argument that if you live in a small town in a country with not the best access to medicine, you're going to have a harder time, trying to survive into your 90s and hundreds. But I also hear stories about people who grew up in an area where they were farming and they only had access to one or two or three vegetables. They didn't have this whole variety of different things, but they were organic, and those people ended up having a life that went into the 90s and the hundreds. These are people that, for example, might have only eaten tomatoes and cucumbers because they grew them and that's what would grow in that climate. And again, they would do well. So it just begs the question, how much does the food where we live actually have an impact on our overall survival?